So welcome from me. Very nice to see you all. Nice to see some familiar faces, some local partners here, and also many of our staff as well. And in addition to Cherry's point, before I go through my slides, I just want to pay a personal tribute to the staff of the organisation. I've been really impressed with the way in which our staff have responded to the uncertain times that we face, and have continued to really focus on the business at hand, which is really giving the best possible care to our patients. And some of the information that I share with you in a moment will show that many of the aspects of our care for the patients that we treat have improved during this period of time and continue to improve. And I'd also like to pay personal tribute to my team as well, who, as a leadership team, have probably one of the most complex leadership challenges in the NHS at the moment, and they're doing a fantastic job. And so I don't often get the opportunity to thank them in public, but I'd like to do that as well. So let's move on. I'm well known for taking much longer than I'm allocated, so I will try to be brief and give plenty of time for you to hear from some of the fantastic services that we have within the organisation. So a little bit for those of you that are less familiar with Epsom and St Helier, we have three main hospitals, obviously St Helier, Epsom and Sutton hospitals. We deliver care from a number of other sites, and are soon to occupy the new Wannington local care centre known as the Jubilee Health Centre, and provide health services for the east part of Sutton, hopefully from South Croydon as well. We serve 420,000 people a year. You can see the numbers for yourselves. Large numbers of A&E attenders across both of our sites, over 5,000 births. A turnover of £331 million, which puts us in the large trust category within the NHS. 4,700 staff and volunteers, without whom we couldn't continue to deliver the services, organised in what are known as clinical directorates, which is, if you like, the way of organising our services so that it makes sense to patients to be looked after by clinicians and clinical teams that work alongside each other. You'll see there the slide that talks about what we stand for. On the left-hand side there is our organisational values. At the top of the list is putting patients absolutely first and at the centre of everything we do. And we can only really do that by working as a team. There's plenty of evidence to say that good clinical teams, multidisciplinary teams, provide better experience and better outcomes for patients. And it's one of the things that we're particularly focused on in this organisation under my leadership. And we're also focused on the point about continuous improvement. We know that there is always an element of what we do that we could improve on, so we have a real focus on continuous improvement. On the right-hand side, our priorities, which generally are similar priorities for us coming into this financial year, and I'll touch on those in a little bit more detail a little later on. The headlines over the last year, so this is the year up until the end of March, we met the vast majority of the government's key standards, including the two most important headline measures which the government is most focused on, which is the A&E emergency access 4-hour target and the 18-week referral to treatment target. As Cherry's also said, we were named in the Dr. Foster guide as in the top 21 trusts for providing the safest care. We had the Care Quality Commission, who you may know is the quality regulator for NHS organisations. They visited us a number of times over the last 2 years, and we had an unannounced inspection during that last financial year with a clean bill of health provided by them in relation to the services that we provide. And they've also been back this year and made a view that we were fully compliant. As Cherry's noted, that we're continuing the process to separate our hospitals, Epsom and St Helier demerger, and colleagues from Ashford and St Peters are here this evening. I'm sure we'll be happy to take questions in the conference room. And the St Helier redevelopment continues to progress. and we are in the process of starting to spend this year's allocation on preparing Sutton to receive services that are provided in Ferguson House in order for us to then demolish Ferguson House and also the nursery. And it's if you haven't heard this joke before, I do apologise if you've heard it several times, but I did think it was a good idea to empty the buildings before we demolish them. Celebrating success, we've had continued good feedback from patient, staff, volunteers. I'll come back to that in a moment. We've opened a new day surgery facility and endoscopy facility at Epsom Hospital, absolutely fantastic. We invested, despite our financial challenges, a significant sum of money in redesigning the way in which patients that come through our A&Es are then treated through their emergency pathway, very much bringing us into the modern era of delivering emergency care through our acute medical units. Our maternity team achieved the risk rate, level 2 of 3 of the risk ratings for safe maternity care. There are very few NHS hospitals that hold the CNS2, which is Clinical Negligence Scheme for Trusts, level 2 status, which I think is testimony to our focus on quality and safety of care. We also opened a new CT scanner at Epsom during that financial year, and the new Justice Secretary opened one of our laboratories on the Epsom site during that year as well. Our urgent care centre, which had already been up and running, received a boost of capital monies to extend it and redevelop it, and those of you who come in through the main entrance this evening would have seen the building works going on. We also, through the patient experience and environment surveys, which is the PEAT surveys, scored excellent for both food provision at both Epsom and St Helier, which was an improvement on the previous year. And also we scored good associated with our cleaning standards as well. So we continue, again, to focus on improvements in that area. We continue the campaign and the challenge around reducing hospital-acquired infections, and we've achieved a year-on-year reduction. And you can see there some other highlights in investment in our cancer services, in our renal service, and we also had a particular focus during the financial year on car parking. Car parking is something that is extremely dear to people's hearts, and we had previously been criticised for the way in which we'd handled some aspects of that, and we went from, like Manchester City in some ways, with a bit of investment, went from the bottom of the league to the top of the league, and were voted by Which as being the most improved hospital provider of car park services. Further investments, you can read there, significant amounts of money being continued to be invested in our hospitals, new x-ray facilities. I've talked about the day surgery facility, oral surgery, bits of kit, bits of equipment, and you'll see there at the bottom that we're continuing to spend monies that are made available to us on St Helier redevelopment. And this year's allocation coming into this financial year, you can see again significant amounts of money on improving computer systems, a new children's nursery to re-provide nursery facilities for our staff as we demolish the existing one, and a new lithotripter, which is a piece of kit that blasts kidney stones, was opened recently at Sutton Hospital. So those are some of the headline components of the financial year's successes. I want to just spend a few minutes just talking about some of the key national standards which we are closely scrutinised against by both our commissioners but also by the Department of Health. At the top of the list there, we always talk about quality and safety first. The hospital standardised mortality ratio is essentially how safe are your hospitals, and you can see that the expectation is that we were to be at least, if you like, below 100. 100 is the average, and you can see we came in at 84.4, which is the indicator that put us in the top 21 nationally by the Dr. Foster Guide. You can also see there the other components that were achieved. We didn't meet the target on MRSA bacteremias. We were set a target of 5. We had a total of 8. The previous year we had a total of 11. But it's interesting that the requirement for our laboratories is that we have to count all samples that show up with MRSA, not the number of patients that actually have an infection. So within that 8, we only actually had 4 patients that had the infection. So that's 4, in my view, it's 4 patients too many. But it would have met the target had the target been measured in a different way. I talked about 18-week referral to treatment targets. Again, rock solid performance there. Stroke performance, whilst not meeting last year's standards, has improved immeasurably, and Brendan will talk about that during his presentation. And I put there at the bottom the focus on improvements around appraisals. Appraisals in every industry are the mechanism for ensuring that staff feel valued, are recognised, have a development plan, and are meeting their objectives. Again, we've improved massively across the last year in the number of staff that are having a regular appraisal. So this financial year, we continue to focus on a similar range of priorities under a similar set of headings. So delivering safe and efficient clinical services, clearly we have to continue the drive towards meeting key government targets. Please don't think that targets are something that are being if you like, stopped in the NHS. In fact, they are increasing year on year. So we have to continue the hard focus on making sure that our patients get the best possible care and access. And in a financially challenged environment, we have to absolutely keep a grip on cost, and delivering our quality and cost improvement programme. £17.7 million savings challenge equates to about 5.5% of our turnover, and that's no insignificant task for any organisation. Improving the patient experience is very much about continuing to do whatever we can to improve the safety of our hospitals and reducing hospital-acquired infections. My experience is happy and well-trained, developed staff equals good, happy patients with good care. So we're going to continue the focus on developing and appraising our staff. And we're also having a continued focus this year on helping to address the reasons why we have higher staff absentee levels, and to make sure that we can bring ourselves back in line with the average levels in the NHS around staff sickness and other causes. And making sure that we progress the redevelopment of St Helier and continue the upgrading across all of our hospitals, including Epsom and Sutton. And I mentioned earlier about the route to Foundation Trust and our partnership with our colleagues at Ashford and St Peters. Hopefully you'll be aware that Ashford and St Peters were announced as the preferred partner for Epsom Hospital back in June, and we're continuing the journey towards making that happen towards the spring, summertime next year. And then in the meantime, we're working through how we secure a long-term, clinically and financially viable future for the St Helier Hospital, particularly in the context of the strategic changes that are being proposed by commissioners locally. And talking about that, I think it would be wrong not to mention that. You'll know that Better Services, Better Value programme is well underway, and is a review, just to summarise, a review assessing NHS care across South West London, including the services provided by hospitals. You'll know it's led by colleagues, essentially led by colleagues at NHS South West London, but many of our teams and our local GPs have been involved in the process thus far. The recommendation that is likely to go to consultation is that St Helier's portfolio of services changes in the future, and as you can see, and you'll know, I'm sure, that the proposal is that St Helier provides the role as an elective centre and a local hospital for South West London, and A&E services and maternity services and paediatric services are centralised at St George's and provided at Kingston and Croydon. But you'll know also, I hope, that this is all subject to public consultation. and no decision has yet been made and won't be made until well into next year. And you'll also know that we as an organisation have raised a number of questions about the outcomes and the process, predominantly about the need for quite a radical transformation of out-of-hospital care to enable an A&E to close within South West London. We're also keen to see a solution for St Helier that resolves the long-standing financial challenges that this organisation's had. And we also believe that there's an important factor here around making sure that all hospital services across South West London are brought up to the very best in the health service. And in the meantime, whilst decisions and preparations for implementing these proposals in 2016-17 are underway, we want to make sure that services can be maintained across all of our hospitals in the meantime, and that services and the quality of services are not eroded by recruitment challenges or problems around staff retention. So we've raised those concerns, and I'm sure there'll be some questions about that later on.